Hey, Dr. Sam here. Today, we're going to talk about emotional injury OCD. It's something you probably haven't heard about, and as we'll get into, there's good reason for that. It's been overlooked for a long time. However, if you've been diagnosed with maybe social anxiety, or you identify as a person with codependency, people pleasing tendencies, maybe complex PTSD, or a host of other issues, and you feel like those labels or diagnoses don't quite capture who you are, or maybe treatment just really hasn't been as effective for you as you may have wished, it's very possible that emotional injury OCD may better fit your set of symptoms. So today I want to give an overview. We will have some videos that will specifically look at the differences between emotional injury OCD and some of these other diagnostics. Please click on those if you're interested to know more. It's really important to get the right understanding of disorders because based on that, we formulate our treatments. And in this case, treatment may not work well for you unless you understand exactly how this subtype of OCD works. So first, let's define what OCD is, and then we can get into what emotional injury OCD is and why it is that it's been overlooked for such a long time. So OCD is obsessive compulsive disorder. There are two pieces, it's right there in the name, obsessions and compulsions. Obsessions are anxiety-inducing thoughts, images, urges, and they're intrusive, they're unwanted. They make the person feel like they wish they would go away. So they're persistent. The fact is, people have intrusive, uncomfortable thoughts frequently. In fact, that was a misunderstanding early in the research and clinical understanding of OCD is that these types of thoughts are unusual. In fact, they are not. However, the relationship with these types of thoughts does cause problems because for people with OCD, they want that anxiety to go away, and it's very persistent and it's focused on a specific area of concern. So then what do people do? I'm having these thoughts, they're bothering me, I can't make them go away. Well, I do one of two things. Either I avoid situations that are related to these thoughts, or I engage in what are called compulsions. In most cases, it's some combination of the two. Compulsions are behaviors, often overt behaviors. For instance, probably the best known is hand washing, where a person has, say, an obsessive fear of contracting a disease, perhaps themselves getting sick or getting other people sick, and as a result, they engage in a behavior, in this case hand washing, that in the short term reduces that anxiety. And we can, I think, all understand why that might be appealing. If you're feeling a lot of anxiety, what's the first thing you want to do? You want to make it go away. Well, that's exactly what happens. However, because that person never fully experiences the fear and learns that they can, in fact, tolerate the fear, in some cases even habituate to the fear, make it such that they no longer have that fear. Because they don't face it head on, they never fully move on. And not only do they not move on, but the intensity of the compulsions and the intensity of the obsessions tends to go up over time, and it kind of spirals out of control to the point where the person is engaging in compulsions on the order of 1 hour or more a day, and or it's causing really significant distress and impairment, that they've reached a point where they are excessive. And that really is the differentiating point. We all engage in little rituals, compulsions that make us feel better, but at the point of OCD, it's getting in the way. We're no longer, say, with hand washing, we're no longer talking about hygiene. We're talking about something that's causing serious problems, the problems with the skin, problems with being able to go about your day-to-day business. Now, just because hand washing is an easy to think about type of OCD, it certainly doesn't mean it's the only type. There's many other types of OCD. One of the most common cognitive features, cognitive meaning thinking, features of OCD is that people often feel an inflated sense of responsibility in the world, as well as a very low tolerance for uncertainty. So combined, the feeling is if I don't do this thing, then something really terrible is going to happen. Or at the very least, I can't tolerate the possibility that it would be my fault. And maybe you can relate to that. If so, you can imagine what is, something that many people experience, what it might be like when it reaches kind of a pathological level. So this worry about others, it can take the form of being, or worry of being responsible for bad outcomes. It can take the form, for instance, of being afraid that you're going to get your family sick and that they might die, or that if you don't check the locks on your house, someone's going to break in, or if you don't check the stove to make sure it's off, or perhaps you're afraid that you hit someone with your car and you need to go back and check, because if not, then you won't know if you did this terrible thing. These are all examples of physical harm that people may be afraid of inflicting with these kind of intrusive obsessive fears. Now, there's other types of obsessive fears that are kind of more related to magical thinking, but I'm going to focus on these because the fear of physical harm has in many ways a lot to do with our topic for today, emotional injury OCD, which at its root is a fear of emotional harm to others, that some kind of harm will come to others from my behaviors, from my actions, that will have significant negative impact on them. So not just an inconvenience, but that I will be responsible for doing some long-term hurt to this person as a result of my actions. And specifically, in most cases, what I mean by this kind of hurt is that it will somehow infect their sense of self, their sense of importance or value in the world, and that would be truly terrible, and it would be all my fault. So that's the obsessive fear of emotional injury OCD. I am going to cause an emotional injury, a serious emotional harm to someone via my actions or behaviors. And so the next question then is, if someone were to have this type of obsessive fear, you might relate to it, by the way. Many of us do fear hurting other people's feelings, but the type of fears that happen in obsessions, we now know that they often do take the form of fears that many people have. But let's say you're just really fixated on this. It's coming up all the time. It's getting in the way of your day-to-day life. What kinds of behaviors, what kind of compulsions might a person engage in to alleviate, at least for the moment, that fear, that obsessive anxiety? So the truth of the matter is we don't often assess for this. It's not really part of our questionnaires, our interviews that we do in assessing OCD, but there is some conversation that when someone is really afraid of causing this kind of emotional injury, that you might expect that they would do reassurance seeking. This is a type of compulsion that you see in other types of OCD as well. Making sure, did I do something wrong? Did I hurt your feelings? And I think as a result, that's what people look for if they think that there is something along the lines of kind of an emotional injury type OCD. But it may be that this has really clouded our understanding, kind of jumping to this conclusion. Because if you stop and think about it, if the fear is so deeply held that I am going to cause this discomfort, emotional discomfort or pain or distress to other people, then frequent, repetitive reassurance seeking would not really do any good in alleviating my anxiety. If anything, what would it do? It would cause me to worry even, or maybe in this case, obsess even more about the possibility that I'm really upsetting this person, that I'm inconveniencing them, that I'm bothering them. In other words, I think checking is a really unusual compulsion should someone have these types of emotional injury obsessions. So what might it be then? What kind of compulsions would allow a person to repair any perceived emotional injuries that they'd caused to another person, and also to prevent. We see both of these in other types of OCD, both the need to prevent and repair from perceived cases of harm, or some sense of responsibility for wronging other people. So what might we see? One possibility is that you would see compulsive, anxiety-driven behaviors that closely resemble socially celebrated, socially sanctioned behaviors like excessive apologizing, excessive gratitude, excessive agreeing, excessive praising, excessive aspiring to be like that person, and the list goes on. These, if they are driven by anxiety of not wanting to cause or wanting to repair some emotional injury to others, and they go past the point of a normal social norm. They go to the point where it's impairing that person's ability to function in day-to-day life, and it's causing significant distress, and it's far in excess of what we expect in others. In those cases, we really ought to think of this as compulsions. And by and large, I think we've missed it because, well, for one reason, compulsions tend to be very discomforting. They're not pleasant. When you see people engage in compulsions where they're frequently checking locks or looking to see if they hit someone in a hit and run or washing their hands to the point of it being in excess, it's really clear in most cases because we would like them to stop. It's uncomfortable. However, if there's someone who's being incredibly considerate and attentive to our feelings to the point that it's all-consuming for them, in most cases, it may be received as pleasant, despite the fact that this individual is experiencing a tremendous amount of distress, that it might be impacting their sleep, it might impact their ability to develop good relationships because they're not bringing much of their real self to it, yet people might be drawn to it. And it might even allow that person to be successful in certain areas of life despite the distress and day-to-day difficulties that it creates for them. So in one way, these types of compulsions look too typical. In another way, I would say they're very atypical because they may come off as pleasant. And so in large part, I think as clinicians, as the clinical community, we've been blind to these compulsions because they don't fit the form that we expect of compulsions. Instead, all along, we should have been focusing on their function. That functionally, they are reducing the anxiety and they are bypassing the process of habituating or learning to live with the anxiety and fear that comes with these obsessive thoughts. Okay, so we do have now a sense of why we might have missed these as a clinical community, but it doesn't answer another important question in why emotional injury OCD has been so overlooked. And that is, why haven't people who have this particular type of OCD not self-identified, right? I might miss it as a clinician, but if somebody comes to me and says, look, this is really difficult for me, I'm struggling with X, Y, and Z, that should be enough right there. And in most cases, virtually in every case, people who come to you in a clinical context eventually will give you a sense of what their symptoms are so you can base treatment off of it. But wait, let's think about the symptoms of emotional injury OCD. First, and maybe chief among these, is a need to affirm the importance of other people. And I would say in particular, when someone has a position of authority, as we all do in clinical work. So, the moment that someone provides a conceptualization of that person, a diagnosis, an explanation of why they are the way they are, even if it's completely off base, what is likely to happen? that person's going to have an obsessive fear arise. Oh no, I'm going to insult them. I'm going to make them feel unimportant by contradicting them. And so what will they do? I'll agree. And how do I feel after I agree? Much better. I feel relieved. And so you have this compulsive agreeing with other people that in itself is a barrier to self-identification. But you might say, well, okay, they agree, but maybe later on they have to realize that on some level they disagree, right? Even if in the moment they feel a compulsion to agree. Well, there's two different types of compulsions. There's overt compulsions where, like a behavior, like agreeing with somebody, or hand washing for that matter. There's also mental compulsions, which are compulsions that a person does internally that are not visible to the outside world. And we might think that in a person with emotional injury OCD, one of the best ways to prevent or to ensure that you're not going to do more damage to another person would be to internally disagree with oneself, to internally self-criticize, to internally agree with others, to internally praise and elevate others, to internally have compulsive thoughts that function to reduce that anxiety. If that's the case, then not only am I openly agreeing, but internally I am working to agree as well. And of course, the really interesting part, I think, of this presentation is that as a result, if I don't have much access to disagreeing thoughts or feelings internally, it actually enables, it facilitates my ability to agree, to praise, to do these other compulsions that even further go towards ensuring that I haven't caused emotional injury. So there you have it. We have an instance where the compulsions present in a very unusual way, and we have individuals who have phenomenally low access to disagreeing. They're highly suggestible. And should they ever even get to the point where they do have awareness, which is quite a task in and of itself, even still, the thought of accepting a diagnosis like this might raise fears of insulting other people about the legitimacy of their kindness or love towards others. There's layers upon layers of reasons that it's very difficult for a person with emotional injury OCD to access the reality of what's going on, despite the fact that they know on some level that there's something that's not right. That's where they may look for other explanations. We'll go into those a little bit further. That might be where they just accept that there's nothing wrong with me. I just feel this way. I just live with a constant level of stress, anxiety, but label it as something that's non-clinical, despite the fact that it's creating really serious problems in their lives. It might manifest as somatic or physical symptoms. There's a whole host of other ways that this can manifest. We'll go into that in more detail elsewhere. The really important thing as we're starting to explore this new concept is that an understanding of the mechanisms, the way all these pieces fit together and the diagnosis is critical to effective treatment planning. And so as we move forward in this series, my intention is to tie this together and show how not only does this tell us how to treat emotional injury OCD, but it also tells us a lot about certain types of other treatments that might have the exact opposite effect of what they're intended. They may be great for most people, but are particularly bad for this population. So we can explore some of that together as well. I think that's it for this particular video. If you're interested in learning more, I'll put links to ways to engage, whether you want more educational opportunities, clinical opportunities, training opportunities, to work with me and others in community who are interested in emotional injury OCD. I'll put that below for all those who are interested. Please reach out if you have questions, subscribe, click the notification bell so you can get more content and information as we put this out there, and take care. I'll see you next time.